Bismillahirrahmanirrahim. Excellencies, ladies and gentlemen, Assalamu alaikum and good morning. Thank you for inviting me to your roundtable consultation on nutrition and healthy lifestyle. When Shahu asked me to, invited me rather, to this gathering, I asked her what should I talk about. And she said this is about obesity. The main discussion will be on obesity. And then I called Azza. And, and I asked her that I have to go to this meeting and what would you like me to say? And then she said that this is a roundtable of very technical people. And I told her that I'm not a technical, especially I'm not a public health expert and not a technical person in that area either. So I told, I said to Azza that I'm going to share with them what we did in Tajuddin School. I was a principal in Tajuddin School long time ago. And you might be wondering why I should be talking about this now. And I strongly believe it's still relevant. What we did in Tajuddin School was relevant, and what they are doing even now, the continuation of what all the principals did in terms of nutrition and healthy lifestyle is still relevant. So we conducted three main programs in Tajuddin School. The first one was started by Madam Mana when she was the principal, and she introduced a weekly exercise program for the whole school. The school students, they come down for the assembly, and then not too much, but about 5 minutes of stretching and mobility exercises. And this went on, and I'm saying that I think it was even before 1995. So it started a long time ago, and it went on even till I was the principal. That was in 2004. So it continued. The second program we conducted, we had in Tajuddin School was a 4-year program that we had for a selected group of students. But the reason why we started this program was during inter-school activities, and we noticed that the students from the grade 1 students in Tajuddin School were a bit smaller than those in Iskandar School, for example. So we thought, because at that time, not now, it's different now. At that time, the students who came to Tajuddin School was, they had the socio-economic status of those students were not, good compared to those in Iskandar School. So this is one reason why we started this program. And we called it Milk and Exercise Program. And this was when the principal, Abdullah Ismail, was there. All this time, I was a deputy principal, and the reason why I got more involved in this is because my background, when I did my degree in education, I did 2 majors. One was in special needs education and one in physical education. So I had this background to run this program with the help of other teachers and everybody else. What we did was 3 times a week, we gave these students, I think they brought their own milk, and we had a reserve of packets for children who cannot afford, and there's a lot. And even the parents contributed. So 3 times a week, we gave them milk, and then we had this exercise. That was a vigorous 30-minute exercise program we conducted, and we did it for 4 years. You talked about things not being easy, and I agree with that. It wasn't easy. To conduct such a program for 4 years, 3 times a week was a huge challenge, but we still did it. And we had to, in a way, coordinate with once, I mean, every term we had 3 terms then, right? We had to coordinate with Iskandar School because we compared the height and weight of students, for example, in grade 2, the same group in grade 1 and with that of Tajuddin School, we compared. Grade 1, definitely our kids were smaller. And then as they progressed, I think it was in grade 3 or so, there was similar height. Children from Iskandar School and Tajuddin School. I mean, I'm purposefully not saying this as a study, because if it's a study, there should be certain protocols that we have to follow. So that's why I'm just saying it's a program. And I hope they still have those data. I don't know. I spoke to Tajuddin principal yesterday. It was a very quick talk, but I'll still try and find the data for you if it's still there. Anyway, what we found out, I mean, from this program is that we noticed that these students, I mean, just from grade 1 to 4, we noticed that they were more sociable, they were more active, their academic results was really good, and then they excelled in inter-school activities. I didn't have that much time to call some of the students to talk to them how it has impacted their lives. I was able to talk to one student. She's a nurse now, and I think she's going to do her master's in public health very soon. And I asked her whether it impacted her life, and she said it definitely did. And she still plays sports. And when she had the opportunity, even in IGMHO, and she worked in another office before, she has always engaged in sports. And it will be interesting to find out more. I mean, if we can get hold of these students to find out more how it has impacted their lives. The third program we ran in Tajuddin School was, Hussein is there, Hussein will know a lot about this, and I know that many schools do it, even now. What we did, and we had a very dedicated health assistant, so we were able to do a lot because of that. And what we did was did a survey of, and that's what I'm saying. Why I'm saying that a lot of schools do it. We did a survey of things the children bring to interval or break time. We normally call it interval, break time. And then we found out that a lot of children even then bring fizzy drinks, sausages, sweets, and then there is a pig fine, right? In a packet, that's very popular, pig fine. And then after doing this survey, we met with the parents and we talked to the parents about it, and then we talked to parents about healthy choices, and we asked the parents to send healthy food when they come to school. I mean, something we also did was compare these juice packets they bring and the price of a banana or price of an apple, and then made them really see that it is not that much there is not much of a difference. Rather, it is cheaper, I think, than a fruit is cheaper than those milk packets and pig fines or the biscuits they send to school. And I would say that it really changed how the parents thought about nutrition, and we had a lot of positive changes because of that. And while beginning my talk, I said that the reason why I'm talking about is because this is still being continued in Tajuddin School. I talked to Madam Sajida is a parent of Tajuddin School too, and she would know. I mean, I talked to Fatung, the principal Fatung, yesterday, and I asked her about this particular program of bringing fruits, and we had a fruit day. And I am not sure that whether we had a walk to school day, but I think we wanted to introduce, or we had a walk to school day, but I'm not sure about it because it has been a long time. Anyway, What Fatun, the principal of Tajuddin School, told me was that they have added vegetable to the fruit day. So now it's the fruit and vegetable day. And they also have, like we banned fizzy drinks, they banned sausages. And if they are bringing a cake, it should be a fruit cake. There should not be icing on the cake. I don't know how relevant this is to you, to this conference, but I hope that it helps while you deliberate on nutrition and healthy lifestyle, things that we can do, especially when we always talk about how difficult it is to do things. Fatou, the principal also told me yesterday, now when they organize different activities, and if there is food being served, they have to have a portion of fruit. It is a must. Dr. Adai just talked about difficulty in making these choices, or it's not easy choices. Going to exercise is not an easy choice either. And I just wanted to share a personal experience here because hoping that it might help you. I do exercise every day. And I am very conscious of what I eat as well. But when I had little children, when my kids were really small, and when one of them, my daughter was in Tajuddin in grade 2, and my son was in preschool. We have to take them to do 2 different schools. Of course, my husband and I, we both juggled with that. But what I'm trying to say is this, at that time, it was not easy for me to exercise during the morning. So what I did was, I dropped my son to Galal Madrasa and go to Male Fitness Club, exercise, and then pick him up, and then go back home. This is in the afternoon. So I know this is not easy. They are difficult choices, but if you put your heart and mind into that, you can still work on that. That is what I'm trying to tell you. I have talked about this. What I'm going to say next, I have talked about it several times, and then I'm very sure that this is not the last time I'm going to talk about it either. That is, when we talk about nutrition and healthy lifestyle, so anything, we need to walk the talk. Otherwise, it's not going to happen. I mean, schools, what we did in schools, I would say, is a controlled environment. What happens when they go home? What is served at home? Is it pizza? Is it burger? Is it Coke? Or do we serve Aracanets at home? If we do this, if we send good, nutritious food to school, and then when they go home and they are served these foods, we are giving children mixed messages. So this is not going to work. And maybe one of the reasons why it is not working is this whole of government approach to this. And I welcome UNICEF's initiative to bring together different government sectors, civil society, and advocates and individuals working in this space in the same platform to kickstart these discussions. Because there are young children here, I want to mention something. There are ways we can communicate this to young children, young adults, how having a healthy meal or healthy lifestyle, how we can achieve this without them having to feel that it is body shaming. And then I think it's something you really need to take into consideration. I will conclude. I will leave 3 messages before I conclude. One is you can eat all the nutritious food in the world and be physically active, but in order to get the real benefit, you need to pay attention to your mental, emotional, and physical health. The second one is a message I saw on social from His Excellency Dr. Eddie Eddie. He was referring to climate change, but I think this is relevant to all walks of life. What he said was, and I quote, "Inaction is the biggest disease." So I ask every young person to do one thing to look after their environment, because if each of us does one thing, you can imagine the cumulative effect, the cumulative effect in the whole world. So move away from inaction and act on at least one thing, unquote. And this is relevant to nutrition and lifestyles as well. And this takes me to the final, for my final message. What you leave behind is not engraved in stone monuments, but it is woven in the lives of others. I thank you.